Before we begin, I would like to provide you with a few housekeeping notes. If you have any questions throughout this webinar, please use the questions section within the chat box to submit your questions. We will answer questions at the end of the webinar. Also, we'll provide you with a lot of information today. So for your convenience, this webinar will be recorded and available on our website. We'll also send an email notification when it becomes available. Lastly, our contact information will be provided at the end of this presentation. For additional resources, you can also refer to our website at panfoundation.org. Okay, so now let's go ahead and get started. Hello, and welcome to the third webinar installment in our financial navigation webinar series, How to Protect Patients from Financial Hardship, titled Strategies to Avoid and Reduce Medical Debt. This webinar is especially important to us because we often hear from our healthcare providers and pharmacies when there's no funding available at foundations wanting to know how else we can help their patients. We want you to know that we heard your concerns and they did not fall on deaf ears. And that is why we brought together two industry experts to share insights about strategies and resources to utilize when helping your patients reduce medical debt. So let's go ahead and meet our speakers. First, my name is Audrey Corte, and I'm very excited to be your moderator for today. Today, we'll hear from two speakers. Our first speaker is Jackie Hess. She is a Senior Manager of Program Innovation at Family Reach with a passion for social justice in healthcare. Jackie is a licensed social worker who earned her master's in social work and a certificate in health and aging from Rutgers University. As the Senior Manager of Programs Innovation, she works on behalf of patients to minimize the financial burden of cancer care, specifically through the development of new approaches and programs for the Family Reach financial treatment programs. Our second speaker is Jared Walker. He is the founder of $4. Jared founded $4 in 2012 in Portland, Oregon. $4 was born out of a desire to help folks in medical crisis after watching his own family's experience. The organization believes a medical crisis should not lead to a financial crisis, and that is why Jared is on a mission to crush as many medical bills as possible while educating patients and empowering patient advocates. Let's go ahead and review our agenda. So we will start by learning more about the PAN Foundation, medical debt, and why we chose to discuss this topic today. Then review the scope of financial and non-financial patient assistance resources available and how to access them. Finally, we'll walk through the hospital charity care programs and discuss strategies to use to cancel the patient's medical debt. So about PAN. The PAN Foundation is a nonprofit organization, and we're dedicated to helping underinsured people with life-threatening, chronic, and rare diseases get the medication and treatments they need by assisting with their out-of-pocket cost and advocating for improved access and affordability. Since 2004, we have provided over 1 million underinsured patients with $4 billion in financial assistance. In hosting this webinar series, PAN will provide resources to healthcare professionals and patient advocates to implement and improve the financial navigation services offered at their facilities. PAN is a safety net organization, and we're invested in the success of navigation programs across various healthcare settings. Our goal is to support healthcare professionals with the knowledge needed to build the case for establishing and expanding their navigation programs. So we learned from our healthcare providers that it is difficult to make a case for a financial navigator, and that not all facilities have a financial navigator on staff. However, we know that medical debt is a real issue, and most patients battling chronic, rare, or life-threatening diseases are impacted by this phenomenon. They need a knowledgeable healthcare professional to navigate them through this process. In fact, the American Journal of Medicine reported that nearly half of people who experience medical bankruptcy named hospital bills as their biggest expense. In 2014, medical debt accounted for 52% of all accounts in collection nationwide. According to a 2016 Kaiser Family Foundation and New York Times survey, more than 1 in 4 Americans had trouble paying a recent medical bill, and 1 in 3 delayed care because of the cost. So we know that this is a real issue that we need to tackle. So first, we want to know, what is medical debt? Medical debt is unique from other types of debt because it is debt related to healthcare circumstances that often cannot be controlled or predicted. It is the cost of services provided related to the delivery of healthcare, including procedures, therapies, and medications. When paid with loans, medical bills can become a debt, which may accrue higher costs than the original bill. In addition, unpaid medical bill can also be sold to debt collectors and reported to credit bureaus, which can hurt the patient's credit score and overall well-being. A study by the Kaiser Family Foundation reported that medical debt could impact many areas of the patient's life. In the study, 70% of the subjects surveyed admitted cutting back on food, clothing, and essential household items, while another 59% used all or most of their savings. Still, over 30% borrowed money or increased their credit card debt, and some even took loans and cash out of retirement or college savings. On another study by Pan and Morning Consult, 54% of patients surveyed admitted that they did not take their medication or took fewer than prescribed because they were worried about the cost. Ultimately, medical debt related to healthcare expenses can leave patients with limited options for avoiding bankruptcy and affect health outcomes. That is why it's imperative that we have healthcare professionals in the financial navigation field who are knowledgeable and understand the needs of the patients that they support. So that is where our first speaker comes in, Jackie Hess from Family Reach. Jackie, how are you doing today?
I'm good, Audrey. How are you?
I'm very good, thank you. We're so happy to have you here today.
Happy to be here.
So we know that now more than ever, more and more patients are hiring their own patient navigators or advocates to assist them through their healthcare journey. However, to understand the patient's need, we must first understand the socioeconomic factors that is involved in patient care. So can you walk us through how you get started with a patient and what are some of the resources available to help?
Yeah, so that's a great question. And just like you said, before we get into the resources, I think it helps to kind of lay the foundation of how to have this conversation. I want to start by acknowledging that for many of us, asking our patients about their finances doesn't come easily or naturally. Money has long been a taboo topic, something that we're not supposed to discuss with anyone. And certainly the last thing any of us want to do is offend or scare our patients. But the truth is that we don't do our patients or ourselves any favor really by keeping this problem hidden in the dark. We know that most patients experience some form of financial distress, and the sooner that we can begin to assess and understand their situation, the sooner we can help patients overcome obstacles to treatment. So I wanted to start just with some tips that can help kick off the conversation. So when you're getting ready to have this conversation with patients and their caregivers, consider the following. So you'll want to consider the timing and the environment that you're bringing up this topic. Try to find a private space to talk, and when possible, try to connect with both your patient and their caregiver individually. Remember that your patient may not be the person in charge of their household finances, and they may not even be aware that there's any problems going on financially. And also keep in mind that money can be a source of conflict between family members, right? And so your patient or their caregiver might be embarrassed, guilty, or ashamed about the way that cancer is impacting their finances. And so it's really important then to keep those conversations private and individual to both the patient and the caregiver. Another aspect of timing the conversation to keep in mind is just what else is going on for the patient that day. So if your patient just received news, for instance, that they're going to need to begin a new therapy, that could, depending on who the patient is, trigger two different responses. It could mean that finances are top of mind and they're worried about how they're going to pay for that, or they could be so overwhelmed by this news that they need time to process. So in any case, I think it's best to always just ask, hey, are you in a place where you can talk about the cost of care, or do you need some time to digest what the doctor just shared? Next up, I wanted to just talk about the way that we all handle money and financial stress. I think it's important to keep in mind when working with your patients is that the financial consequences of cancer is probably not something that they cause themselves. It's really more of a side effect of their cancer and cancer care. So you might want to introduce the topic by really normalizing this and saying something like, many patients find themselves unable to make ends meet while going through cancer treatment, and then follow that up with a specific question or prompt. So you could say something like, what comes to mind for you when you start to think about the cost of care? Try to avoid those yes or no questions because that can really inhibit a patient's response. And then really validate those concerns. So a simple, I can imagine it's really scary to wonder how you're going to pay for treatment or to wonder how you're going to make rent this month, shows that you are listening, you're willing to have the conversation, and you can empathize with the situation at hand. The last piece here that I wanted to discuss is revisiting the conversation. So if the patient denies having financial concerns or doesn't want to talk about it at that moment, because remember, we're always going to ask first, ask if you can then revisit the conversation at a later date. There's a lot of reasons patients may not want to have the conversation in that moment. Again, they might just be dealing with the reality of their diagnosis, or they might not have even experienced some of the financial side effects just yet. So just assure the patient that you're willing to have that conversation when they're ready and continue to ask at regular intervals. And so then with those tips in mind, I also wanted to share a tool that we developed at Family Reach that can really help frame the conversation. So what you're looking at here is our financial guidebooks. These are available in both English and Spanish and digitally for your convenience. The guidebooks go over cost and saving options, action steps to protect financial health, checklists for estimating your personal costs, and a list of vetted financial resources. So we decided to break the guidebooks down into 3 different age groups, one for pediatric cancer patients, one for young adults with cancer, and one for adult patients. In the end, each version of these guidebooks contains similar information, and the topics that they cover include determining treatment costs, considering your prescription costs, calculating insurance coverage, and learning the laws that can help. So we've included within the guidebooks plenty of space for notes as well as vetted financial resources by category. And then if we could advance to the next slide, you'll see here budgeting sheets that are also included within the guidebooks. So we believe that one of the best things that a newly diagnosed patient or their caregiver can do is to just take a close and honest look at their current and anticipated expenses and compare that against their income or their expected income and their assets. This simple exercise can help patients better prepare for the many ways that cancer might impact their financial health. So these budgeting sheets, which again are found in our guidebook and also on our website, can be shared with your patients to complete at home, along with the help of a spouse, friend, or caregiver. And I just want to note, this is a sample of the expenses that we ask patients to consider. Within the guidebooks, you'll also find space to incorporate other treatment-related expenses like parking at the hospital, wig costs, over-the-counter medicines, and more. So really, it's just getting into the practice of listing out all of these different areas of financial responsibility that can help patients see kind of the big picture and how cancer might impact their finances immediately and then over time. So that's kind of where I would suggest that patients start. And then once you and your patient have kind of like completed the homework, so to speak, you've looked at your budget, you've understand kind of where the gaps are, and have identified those areas of need, you can really begin the work of helping your patient access the resources available to help. So I find it useful to think about available resources in these three categories. So there's support with direct medical expenses, support with non-medical costs, so those everyday living expenses that we're all responsible for that don't just stop because cancer is at our door, and then support with the ongoing financial assistance programs. So if you kind of think about the different supports there, direct medical expenses would include things like patient assistance programs, copay relief programs, and insurance navigation, all aimed at lowering your medical costs. Non-medical costs, that includes programs like Family Reach and other foundation supports, and community resources. So think about like your local food bank or a church that may be able to help. Financial assistance resources, I'm really thinking here more of like the government resources, so local, state, and federal programs and resources, things like SNAP, Social Security Disability, LIHEAP, programs that kind of continue to support the patient throughout their entire experience.
Okay, so Jackie, thank you so much for sharing this in-depth knowledge with us of resources that you have available at Family Reach and how you get started with the patient. Now, can you walk us through other resources that Family Reach uses to assist your patients?
Yeah, definitely. So if we start here with the medical costs and accessing that support. So really, once the patient's treatment plan has been established, your role, you may want to help support them in seeking out assistance ahead of time to keep that financial toll minimal. One place to look is patient assistance programs. So you can use databases such as those listed here. RX Assist is a good one, Needy Meds, GoodRx. These are all online databases that can help you identify where there is patient assistance programs available. Or another tip is to just look at the drug manufacturer website directly. A lot of times they have financial assistance available that's ready for patients who qualify to take advantage of. So I would always say to kind of start there. So that way you are, again, preventing some of these financial consequences that your patients might experience. And then next in your toolbox is going to be the copay relief programs. So thankfully, PAN Foundation has created a wonderful tool. Kind of the gold standard here is the Fund Finder tool, which you can use online to search all available charitable funds based on your patient's diagnosis. So as I'm sure many of us have experienced, these programs can open and close really fast. Funding is limited and there's a lot of people who need help. So one really cool thing about the Fund Finder tool is that you can sign up for alerts. So you can have your patients actually sign up for alerts, and then whenever funding becomes available, they'll be notified or you'll be notified, and you can quickly get that application in to make sure that your patient's able to take advantage of the funding that's out there. And so then the next area, again, is looking at supports with non-medical costs. So these are things like transportation, rent, and food costs. So of course, we talked a little bit about Family Reach, but here at Family Reach, we offer a comprehensive financial treatment program, which includes education, free financial coaching, with a certified financial planner, individualized resource navigation, and emergency relief funding for those who qualify. I'll talk a little bit more about how to access our program in just a few slides here, but keep us in mind when you're thinking of those non-medical costs. Your patient might also qualify for support from other cancer nonprofits. So think about Cancer Care, which helps with things like transportation and childcare, and others like that. I know those general cancer resources are hard to find, so sometimes it's best to really think more about disease-specific organizations. So just a few examples that I've listed here: Leukemia Lymphoma Society, Pancreatic Cancer Foundation, but really, of course, that's going to be dependent upon what your patient's diagnosis is. Another avenue to explore is if there's location-based organizations for support. So one that I've listed here is New Day Foundation, which works with cancer patients out of Michigan. But certainly you'll want to explore if there's any sort of geographic location-based organization that works with cancer patients in your area.
Great, thank you. So I think it's also important to point out other support such as community-based organization and available nonprofit organization. I know that these are type of programs that can also help the patient to determine other type of assistance that can help the patient. So can you talk to us a bit more about these other type of programs?
Yeah, absolutely. So one tool that I've listed here that I love for finding those types of programs is called Find Help. So Find Help is really a searchable database. You enter your zip code and then you enter you enter your zip code and then you can kind of search depending on what type of resource you're looking for. So they have categories for health and medical expenses, categories for food, and what this database does is really pulls up all of the local and national resources that can assist based on the criteria that you entered. So this is a really great way to find those local community organizations that your patients can take advantage of, again, just searching by zip code. And I think if we go to the next slide here, we have a little bit of a demonstration of Find Help, or a screenshot of what it at least looks like. So here you can see again that this database organizes the different categories of help by topic. If you look here in the top left, you'll see that there's a space to enter the zip code. And in this example, the patient was searching for adoption care in a specific area. But you can see that you can look for support with food, housing, transportation, healthcare costs, and more. The really cool thing about Find Help is once you find a program that meets your patient's needs, they'll provide you with sort of all of the next steps that you need. So including the organization's hours, their contact information, their address. So it really helps to give your patient kind of the next steps in order to access those supports. And then lastly, of those three categories, again, of how we're kind of framing our conversation with direct medical expenses, non-medical expenses, and then of course there's ongoing support programs. So again, these are sort of the government programs, such as income replacement, like Social Security disability or supplemental security income, housing and utility support, and nutrition programs like SNAP or WIC. To understand if your patient qualifies for these programs, you may want to work with them to help them access the benefits.gov website and use the benefits finder tool on that website. This is a pretty user-friendly way to find out what programs your patient might qualify for. It will ask them some basic questions about their age, if they're considered disabled, who's in their household, their income level, things like that. And then it'll provide you with the benefits that they may qualify for, the eligibility guidelines, and how to apply. A lot of them even have the applications themselves embedded within that website. So of course, patients may need your help to pull up this website and to complete these initial steps. But definitely, it's once you're in there, it's a pretty user-friendly tool. I think when it comes to government supports like this, it's generally best to carefully review the eligibility, but then start the application early. We know sometimes this can take a long time to get the support that you need. And then also to keep in mind that if a patient doesn't qualify when they're first looking into these programs, you can always reassess, especially if there's changes to income or disease stage or the household structure.
So, Jackie, I know that, most of the information you provided today is specific to the cancer patient, but it seems like the tools and the resources that you provided can be implemented across different type of facilities and organization, that not just for cancer patient, but for other patients in the chronic rare space, disease space. Is
Yeah,
that
absolutely.
That's great to know. And also that I have heard that Family Reach does have a financial treatment program where you provide comprehensive support for the patient with financial navigation and coaching. So can you talk to us a little bit more about the financial treatment program and how someone can get this type of assistance from you?
Sure, absolutely. Yeah. So again, what you're seeing in front of you are the 4 pillars of our financial treatment program. So this includes education, like the guidebooks we went over before, individualized resource navigation. We have a team of navigators who will understand a patient's situation and try to connect them with the most appropriate resources. A free financial coaching program, which matches cancer patients with certified financial planners free of charge to provide that kind of expert lens on their financial situation, and then emergency relief for those who qualify. So for our HCPs listening in today, I definitely wanted to let you know that the best way to access this program is to visit our website at familyreach.org and register for our community. This is a specific portal that we have for healthcare workers where if you register, you're able to then submit applications for our financial treatment program directly to us.
I think we can go to the next slide. Thank you.
And then lastly here, before I wrap up, we listed some additional resources here that may be helpful to keep handy. So just being conscious of time, I want to go through them pretty quickly. So the benefits checkup tool listed first is from the National Council on Aging. That works similar to the Find Help page that we showed before, and the benefits finder tool that we just discussed in the ongoing supports category. But this includes a lot of really good information depending on your patient situation. It's another online tool that you can use. There's a lot of copay assistance foundations out there. PAN Foundation is one, but there's also many others listed here. Cancer Care has copay assistance, Good Day, HealthWell, the National Organization for Rare Disorders. So all of these programs, eligibility depends on the individual foundation and their available funding. And I would again stress just using the fund finding tool because, the fund finder tool. I find that that's the best way to get that information all out of one place. And then lastly, I just wanted to highlight Co-Patient, which is a online platform that allows patients to actually upload their medical bills and have them reviewed for errors. So this can help identify billing errors and help to empower patients to dispute unfair charges or to negotiate their costs and appeal insurance denials when that happens. So that's another really cool new platform.
These are all excellent tools that our healthcare providers and pharmacies can use, today. And I like that you can get assistance based on the geographical region where you are, which provide you so many resources. So I like all the different tools that you provided and resources that you provided us today. It's going to be so helpful to be able to use them and to be able to utilize them to be able to assist the patient. And this brings us actually, and thank you so much, Jackie. This was a very outstanding presentation, and I thank you for that valuable information that you shared with us today.
Thank you.
You're welcome. All right, well, this brings us to our next speaker, who is Jared Walker from $4. How are you doing today, Jared?
Doing great. Thanks for having me. I'm taking notes over here, trying to soak up all that wisdom from Jackie.
Definitely. She provided a lot of resourceful information. You've been kind of quiet over there, though. How are things going?
It's going good. I'm excited to share a little bit about financial assistance and charity care.
Yes, we're very happy to have you. Thank you. So we heard that you have a way to eliminate medical debt that does not involve reaching out to a local program or nonprofit organization or even the patient coming out of pocket for it. So I, for one, I'm really excited to hear more about it, and I'm sure that the audience is too. So do you mind diving right in and explaining to us where different types of medical bills stems from and some of the strategies to help avoid or reduce these type of debts?
Yeah, absolutely. So the first one, and this is kind of going to be where we'll park majority of the day, is going to be hospital bills, emergency room, and then services that are received within the hospital. And then you'll have kind of all the other ones, dental, physical therapy, stuff like that. But for financial assistance and charity care, we're going to be mainly focusing on these hospital bills and things that services received inside the hospital.
Got it. So I know you deal specifically with hospital charity care. So can you give us a background on what that is?
Yeah, absolutely. So charity care, financial assistance is going to be it was put in place with the Affordable Care Act. It's been around for over 10 years. And basically it tells nonprofit hospitals that if they'd like to keep their nonprofit status, then they would have to provide charity care or financial assistance policies. So this is kind of the hospital's way of showing the IRS that they are providing enough community benefit to justify the nonprofit status. So charity care, simply put, is like if you are within a certain income range that the hospital defines, they will have to waive or reduce your medical bills. And then you just have to, figure out how to do that. So, which is what we'll go over today.
Good to know. Okay.
And I went over that already. So this is pretty much, I can dive right in and get into exactly how to find these, how to access these, and we'll get started. So if you go to the next slide. So first, you want to find your hospital's financial assistance policy. This can be tough. If you go to the website of your hospital, just go to the homepage. It's almost impossible to navigate to the financial assistance page. They don't make it right on the homepage. So if you just go to Google and search your hospital name and the words financial assistance or charity care or financial assistance policy, it should take you right to where you want to go, because we are trying to find that policy. So step one is just do a quick Google search, and I would even encourage people to test this out, even as I'm saying it, kind of test it on your local hospitals, and you can kind of follow along. And step two, if you go to the next slide, you're gonna on that page that you get to from the Google search, it will be usually on that first page. It'll have there's the financial assistance policy, there's the plain language summary, there's the application, and we're trying to find the full policy. Now these can be a little intimidating because they can be 40, 50 pages, but we're really just trying to find some pretty basic information, which is how much money, what is the income threshold? How much money can you make and get your medical bills reduced or waived by this hospital. So what I like to do is I just put in do the search, so Command F, and I just put in the percentage sign, because this is all income based. It's going to be what percentage of the federal poverty guidelines are you, and then that's what they base, what they waive as far as from your income. So if you, like on this one, there's a little screenshot here. It says, if your family income is at or below 300% of the federal poverty guidelines, then you are eligible for 100% write-off. And that is kind of, a lot of times hospitals will have a little table where it shows like, this is what we will waive up to, and then this particular hospital also has a sliding scale. So they'll have like a percentage for free care. So if you're at or below 300% of the federal poverty guidelines, you're eligible for 100%. But if you're within 300 and 400, then they still give you a discount of 75%. So it's always good to look for that. And once you find out the income threshold, then you can just compare it to your income. So on the next slide, we see the federal poverty guidelines. There's a handful of tools for this online if you just look up federal poverty levels, because who knows off the top of their head what 300% of the federal poverty guideline is, but you can look up the tables and just compare it to your income. And if you are within the income range, then you should absolutely apply. We have gotten over or almost $15 million in medical bills waived for patients all over the country just by doing this process. So it absolutely works. Thank you. Yeah. And so yeah, next slide. So let's say, okay, you're eligible and you want to apply. How do you do that? On that same page that you found the policy, you're usually going to find the application. There's going to be a link that will have the application. These applications are, they're pretty simple. They all ask the same kind of things. It's like, who are you? Who do you live with? How much money do you make? And then prove it. So proof of income is required. It's actually the most important thing with these. So finding the application is next, and then you're completing it. So if you go to the next slide, this is just an example of a financial assistance application. Like I said, really simple. They'll ask you, who lives in the household, how much money do people make, and then they'll ask you to provide proof of income. So what does proof of income look like? 3 months of pay stubs. Sometimes they'll ask for 3 months of bank statements, a copy of your most recent tax return. If you are unemployed, proof of unemployment, or that you're on unemployment, or that you were denied benefits, whatever you can show the hospital, like the more the merrier on this. It really is the most important part, is proving to the hospital what your income is. So if you can provide a handful of documents and send that in, you should hear back in just a few weeks. So you submit the application, which this can also be a little bit of a challenge. How do you submit these applications? So you're eligible, you completed the application, you got your proof of income. How do you submit it? Well, you can always just walk it into the hospital. But most of the time, unfortunately, these hospitals will only take fax. So you are faxing it in, or you're walking it in, or mailing it. Very rarely do we see like an electronic, upload or email. But sometimes you can get lucky on that. So you submit it to the hospital, and then I wait 3 weeks. I give the hospital 3 weeks to reply. They will usually send you a letter that will give you some type of determination. Maybe they need more information. Maybe they've denied you for some reason, or they've approved it. So that is kind of the whole process. And if you go to the next slide, I'll go over a couple things, because yeah, go ahead, sorry.
Yes, Jared. So before you go to the next slide, I like that there's a sliding scale. So for those that are listening, in case your patient does not fall within the federal poverty guideline, the absolute where they'll cover 100%, is good to know that there's a sliding scale. And so it still might be worth looking into to see if the patient may qualify for assistance. So that's very good to know.
Yeah, absolutely. And I think a big misconception of this is like people just assume they don't qualify. And if you look up, federal poverty level for a family of four, like 300%, which is what a lot of hospitals will do, that's like $80,000 gross annual income. So you can still be eligible for a pretty big discount or even free care. And even if you're a little bit over, I always encourage people like apply anyways, write a letter, tell them that this is a financial hardship for you. These are real people that are reading these, and I have seen, letters explaining the situation do wonders. So absolutely, just because, so many people just assume, oh, it's probably, not that generous, but some of these hospitals have really generous policies.
Yeah, it is definitely good to know that there's an appeals process, and it's when in doubt, just apply. You never know if you're going to be able to be, you're going to be approved or not. And this is very helpful information that it goes a long way in knowing what you can and cannot do. And also, are there certain things to look for when applying for this charity care that maybe someone listening today can make sure that they have like some kind of checklist of what to look for within the policy? Because the policy is really big, and like you say, it could be several pages, and kind of going through all of them is a little bit tough, and sometimes the language is not even in the language where the average person could truly understand. So what are some of the things to kind of look for when they're going through this policy?
Yeah, so the first thing is just the income threshold, trying to find how much can you make to qualify. Then there are a few things that hospitals will throw into these policies. One is minimum bill amount. So this is totally dependent on the hospital. Some hospitals don't have this. I've gotten $36 medical bills waived for people, but some hospitals will have, if your bill isn't $2,500 or $1,500, you can't apply. I always try anyways, but that is something to look for. I try to fight that because I don't actually think that. Well, I'm trying to find out if they're allowed to do that. So I would absolutely apply anyways. Another thing is, where do you live? If you were traveling, sometimes hospitals will say, you have to be a resident of this state to qualify, but there's a couple of exceptions here. If you were on vacation, you had some type of emergency, they usually will honor it. And then also, if you, like, let's say you live in a small town and your local hospital doesn't provide the service that you need and they needed to send you to a different hospital, that's another exception. But sometimes they will, ask you to upload a copy of your, ID or something like that to prove that you live in that area. The most important one here is the age of the bill. This is probably, we get the most questions on this. What's the time frame that you can apply for financial assistance? And it really depends on the hospital, but the federal minimum is 240 days. So you have at least 240 days to apply for financial assistance. And the most popular question we get is, well, what if it's in collections? Medical bills in collections usually happen after 120 days. So you might have a medical bill that is in collections after 120 days, but you always have 240 days to apply for financial assistance, and that hospital can pull your bill out of collections and waive it. So collections is not game over. It is not the end of the road. A lot of people get super disheartened by getting a collection notice, but you always have 240 days. I always fight that as well. If I have a medical bill that's a little bit outside, I I fight it. So 240 days, some hospitals, there's a hospital in California, I believe it's Sharp Medical Center. They do not have any limit. I have gotten medical bills that are 3, 4, 5 years old waived from that hospital. And then also Washington State and Oregon have extended timelines as well. Another thing to look for is insurance. So this one frustrates me because this is another one I don't know if they're allowed to do, but a lot of hospitals will try and say, if you have any type of insurance, you're not eligible. But sometimes people that have insurance, maybe insurance doesn't cover it, or their deductible is still like $12,000 or something. You can still have a pretty substantial medical bill, even if you have insurance. So I always apply anyways, but sometimes in the policies, it'll say, if you have insurance, you're not eligible. And then household size. This is another question we get all the time. If you're in college and you live with 4 roommates, does that mean you're, a family of 4? No, it's like spouse plus children is your household. So, it'll ask household size. A lot of times people ask, what is my household size if I have roommates or whatever. So those are the things to look for. But there are so many different circumstances that pop up all the time. So happy to answer questions.
So typically, is it more common for hospitals to disqualify patients based on the insurance type? Do you see that more in the policies than not?
No, I would say majority of them don't disqualify you for insurance. There are certain states that I see that tend to try that more often, but across the board, it's usually a majority will not use insurance as a disqualification.
Well, that's good to know. As you're saying, it's really imperative to review all the different requirements and make sure that even when it doesn't seem like the patient may be eligible, try to apply anyway, because you might be able to go through an appeals process where the patient can get approved. So it's good to know that you're not wasting your time if you apply anyway, because there's an opportunity to get approved. And sometimes the patient, you've tried everything to try to get assistance for the patient. And so this is like your last resort because you don't have any other way to get assistance for them. So this is very thorough and helpful information that you provided today. Thank you so much for this presentation. And I for one, feel like I can apply for hospital charity care on behalf of the patient just by listening to this presentation. So thank you so much. The information was great. Thank you.
Thank you.
Yes, so at this time, I think I just wanted to remind everyone that it is not too late. You can still go ahead and submit your questions. We're about to move into the question and answer section. So use the chat box and submit any questions that you may have, and we'll go ahead and answer it throughout this time. So it looks like we have several questions that did come in while you two were speaking. So let's go ahead and get started on them. The first one that we received is, I applied for charity care in the past for my patient, and it was sometimes denied without explanation. So what are some common reasons that a patient may not qualify? I guess we can start with you, Jared, and then Jackie, you can go after Jared, please.
Yeah, for charity care, the reasons for denial are, well, first of all, make sure they tell you why. Some hospitals will just deny and they won't explain to you why you were denied. So always make sure that they tell you. Most common is going to be the age of the bill. How old is the bill? And like I said, you usually have 240 days to apply. They might think that your income is too high. I've had people say, oh, they said I made too much money. That's a great time to appeal because there are so many special circumstances. Let's say you had a medical emergency and you were making above the income threshold, but because of the emergency, you are unable to work in the future. That's a time where you write a letter, explain the situation. So those are some really common ones why they would be denied. But like I said, write a letter, appeal it, fight it.
How do you find out why why it was denied? Do you call them, or is that usually also something that was within the policies?
So normally the hospital will send you a letter, or they'll update like your My Chart or something like that. And that's where the determination would be for financial assistance. So they would explain. So let's say, hey, you're denied because we didn't get proper documentation. So send us, these documents or something like that. It should be included in the letter.
Great, thank you. And Jackie, do you have anything to add to this?
No, I have to be honest, Audrey, I've learned so much from Jared today that like I'm thinking just fight it. That's all that's going through my head right now.
Great, thank you. And then also, we received another question. So that question is there a training course? This is a really good question, actually. I'm sure a lot of people are thinking about it, especially if you have someone onboarding at your facility, or even if they're seasoned and they just want to learn more. Is there a training course or a training or course that I can take to learn more about assisting patients reduce medical debt? So I guess we'll go to you first, Jackie, and then we can go to Jared.
Sure. So definitely within oncology, I would say that a training course that I've undergone myself and that I thought was really helpful is through ACCC, the Association of Community Cancer Centers. They host a financial navigation training that you can do online at your own pace. That is a really excellent resource for giving the basics of like what is financial navigation and how can that work to save your patient's money and at the end of the day save the hospital money too. So that would be the first one that comes to mind. I know that also Triage Cancer is a great resource for education, and they also host conferences specifically for healthcare providers, so I would check them out as well. I think their website is triagecancer.org.
Okay, those are good resources. Jared, so do you offer a course with your organization, or do you know of a course that would be great for someone listening or any facility that's looking to onboard someone and need to train them on financial navigation?
Yeah, so for financial assistance and charity care, $4 does courses. So every other Monday, I go live on Instagram and TikTok and all that, and I actually did one last night, and basically just go over this same material and then answer questions. Then we have an entire site dedicated to patients that just want to take the info and run. We at $4, we will advocate for the patient and do a lot of this for them, but some patients just want to take the info and do it themselves. We have a step-by-step process. If you go to our website, $4.org, and click on the debt forgiveness tab, there's a bunch of information there. So yeah, we definitely do that.
Okay, thank you. This is very helpful. And okay, so I see one question, and I think maybe based on time, this may be the last question that maybe we have time for. But the question is, it looks like it's two parts. It says, if I do not have a financial navigator staff at my office, can I contact Family Reach or $4 directly for their services on behalf of my patient? And the second part is, or does the patient have to initiate contact with the organization? I think, Jackie, maybe you start and then Jared.
Sure. Yeah. So definitely contact us on behalf of your patients. Like I said, our online community is specific for healthcare professionals and is the absolute best way to access our services. So I would say usually the best way, again, is just to have the HCP contact us directly.
Wonderful. That's great. And I'm sure in just one more slide after we finish this question and answer, we can get that information. And Jared, if you can also answer the same question, that would be great.
Yeah, so we work with a handful of organizations that have patients that may be eligible for charity care. Absolutely reach out. You can just send patients or fill it out for them on our website if it's like one-off thing. If you plan to send like hundreds of patients our way, definitely shoot us an email or go to our contact page. We do work with a couple organizations that are submitting handfuls of patient applications to us, and we try to have like a dedicated volunteer team or staff work with those, so the patients are getting responses quickly. So absolutely reach out.
Okay, that sounds great. Thank you both so much. And so I just wanted to remind the audience that if we did not get to your question, because this is all that we have time for, but if we did not get to your question, we will respond by email and provide an answer for it. And also for more information on what we discussed today, you can check out this excellent resource webpage on our slide, and to get additional information there. All of it is just really great resource to be able to get started in helping your patients. So I want to go ahead at this time and say thank you to all our panelists, Jared Walker and Jackie Hess, for this insightful presentation on behalf of the PAN Foundation. We're so grateful. Thank you for joining us today. We learned so much about available resources that our healthcare providers and pharmacies can start applying today. And that is the key, that they can start using it right away. So that is really great. Thank you. And if any member of the audience want to reach you about either our presentation today, or they just have more questions, can you all tell us how they can get a hold of you, Jared, if you can start?
Yeah, so you can always just go to dollar4.org and hit on the contact page. We'll be in touch right away. But if you have a question for myself, my email is right there, jared@dollar4.org.
Great. Jackie?
Yeah, and definitely anyone who's interested in learning more about the financial treatment program can visit our website, familyreach.org. And if you have any questions for me, I'm happy to connect. My email is listed here, jhess@familyreach.org. And you can also find me on LinkedIn.
Thank you, both Jared and Jackie. So I also want to extend a big thank you to our audience today for spending your afternoon with us. We hope that you have a wonderful rest of the afternoon, and a kind reminder that we will email the information shared today to those who attended or registered for this webinar. Our next webinar in our series, How to Protect Patients from Financial Hardship, is a two-part webinar and is scheduled for May 17th and May 19th. So the first one is titled How to Make a Business Case for Case Management or Financial Navigation at Your Facility. That will be the one on May 17th. And the second one will delve into a case study of making the business case to implement a financial navigation program at your facility. So we encourage you to register to join, and we will send the registration invite as soon as it is available. And we hope to see you then. Again, thank you all so much for your time this afternoon, and have a great afternoon. Thank you.